Hey there, this is Dr. Mike Stair, owner of Spectrum Fitness Consulting and the owner of Orthopedics Plus Physical Therapy. I want to talk to you about a really important and common condition, knee arthritis. And I also want to talk to you about an intervention that very few professionals are going to talk to you about in order to solve knee arthritis. Now, if you have knee arthritis, you're probably looking into one of a few options. Probably looking into maybe surgical management. Maybe you're looking into pharmacological management, taking oral anti-inflammatories or local injections of cortisone, or maybe you're looking into exercise and physical therapy. All are great options. But those options are not going to work if you have one significant issue not addressed, and that's weight loss. For some reason, healthcare professionals are not adequately addressing this issue, and it's completely in contrast to what we see from the research that is related to the cause and the progression and the treatment of knee arthritis. So that's what I want to do for you guys right now. And let me share with you some insights that can help you get started. Now, the incidence of knee arthritis, they have found, could be reduced by 30% if we simply just better manage our body weight as a population as a whole. Now, the other good thing here that we realize is that if you are under normal weight and you don't have knee arthritis, and then you increase your body weight, we found that that actually increases your risk of knee arthritis significantly. In fact, being overweight increases the chance that you're going to have knee arthritis by 50%. So it's something that's really important. If you don't have knee arthritis now and you're dealing with a weight issue, that's something to be in strong concern about. Now, the good news is, what happens if you do have knee arthritis and you're overweight? Well, if you lose weight, things can get a lot better. In fact, they found that losing weight will actually slow down the rate of cartilage loss, which is critical. And also, when you lose weight, they found that it significantly improves your pain and also improves your function. So the other good news is that a part of that process of losing weight can also be something that significantly helps the symptoms of knee arthritis and the progression of arthritis. And that's obviously exercise. Now, a neat study came out in 2005 that showed for the first time that exercise might actually help facilitate cartilage regeneration. Cartilage was thought to be previously some dead inert tissue that had no capacity for regeneration. But we're starting to see evidence to the contrary. It might actually help facilitate some regeneration. Now, the other good news is that we have great evidence that shows that working on strengthening will actually improve your function and improve your mechanics of your knee, that it's favorable to improve the status of your knee arthritis. In fact, if you look deeper about what they talked about for strengthening, it was actually strengthening your hip muscles. Now, that might seem odd, but if you understand the mechanics of the knee, it makes perfect sense. One of the common bones that makes up the hip joint is also the bone that makes up the knee joint, and that's the femur. And if you can better control the femur, you can better control the knee mechanics. And that's why they suspect by strengthening the hip, we can have a good impact on the knee. Now, what about other interventions, though? What about things like cortisone? Now, frankly, I would love that option for cortisone to be the most effective treatment for the knee. It's simple to do. Other than a few moments of discomfort, it doesn't really hurt that much, and it doesn't take up much time. Now, here's the problem, though. By using cortisone injections, we're obviously ignoring the evidence that shows that weight management and exercise is critical. So it can never be a standalone treatment. It needs to be an adjunct at the best. Now, the other thing to consider, though, is does it cause harm? And there's actually a decent study that came out in 2016 from the Journal of American Medical Association. And they wanted to see what happens if you compared a group of people with knee arthritis with a group of people with knee arthritis that used cortisone as a management strategy. And those people were given injections every quarter for 2 years. And the folks that got cortisone injections over 2 years actually had reduced joint cartilage compared to the group that did not. So you have to be concerned about using that as a long-term strategy. So now let's get back to the main intervention, and that is weight loss. How do we do that in order to make a big impact on reducing knee arthritis, whether we prevent its onset or we treat the symptoms and actually prevent the progression of it and improve symptoms? Well, in order to lose weight, we have to do 3 basic things. Number 1, we need to control our diet. Number 2, we need to control our sleep, and our stress. If sleep and stress are out of whack, we know that weight loss is going to be a big challenge. And a third part is exercise. Now the good news is that exercise has a dual benefit. We know that it will improve function, prevent the progression of knee arthritis, and reduce pain. But it also is a vehicle for helping facilitate weight loss. So the big issue is, how do you exercise if you're in pain because of knee arthritis? We know based on the evidence that if you get stronger and improve your mechanics of your knee, that will improve the knee arthritis. But what happens if when you try to exercise, it increases your pain? It becomes a vicious cycle, right? Well, that's really a big issue about how do we dose exercise appropriately. And that's something that we're specialists in. Now, in my future videos, I'm going to talk to you about strategies for weight loss via diet, via controlling stress and sleep, and also show you some examples of how you can do some exercise that won't aggravate the knee arthritis pain and will instead help prevent the progression of knee arthritis. But in the meantime, I want to leave you guys with a resource that you can use to act on right away if you want to start addressing your weight loss issues related to knee arthritis. So the first thing you can do is go to spectrumfit.net. There you can sign up for a free consultation or get some free information. And that is the best way to swiftly start working on weight loss goals to try to make sure you get control of your knee arthritis. And if you have yet to have your knee managed by physical therapy intervention, that's a great place to start as well. You can go to our clinics in Beverly or in Burlington. If you want to call to get an appointment and get started, you can call at the Beverly office, 978-927-0907, and you can get started right away. We take your insurance, and we'll start working on an effective exercise management strategy for your knee arthritis. So really looking forward to helping you more in the future. So stay tuned to future videos. But in the meantime, reach out at spectrumfit.net or orthopedicsplus.com, or simply call us at 978-927-0907, and we'll get you started working on true solutions for your knee arthritis. All right, thanks for tuning in. Till next time, Dr. Mike Stair. Take care.